Hi guys, if you haven't heard by now, the WHO World Health Organization declares the coronavirus outbreak a global pandemic. The World Health, as the coronavirus rapidly spreads across the world, we're deeply concerned, but both by the alarming levels of spread and severity, and by the alarming levels of inaction. The WHO's chief said. Officials were reluctant to make such a declaration. Declaring a pandemic is charged with major political and economic ramifications. So they just said a few hours ago that the new coronavirus, which was unknown to World Health officials just 3 months ago, has rapidly spread to more than 121,000 people from Asia to the Middle East, Europe, and United States. In the past 2 weeks, the number of cases outside China has increased 13-fold, and the number of affected countries has tripled, said the WHO director. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, the number of affected countries to climb even higher. Several countries have now been able to suppress and control the outbreak, but he scolded other world leaders for failing to act quickly enough or drastically enough to contain the spread. We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have rung the alarm bell loud and clear. Cases in China and South Korea have significantly declined, he said, adding that 81 countries don't have any confirmed cases and 57 countries have 10 or fewer cases. Lack of resolve. We cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic, he said. Excuse me. Some countries are struggling with a lack of capacity. Some countries are struggling with a lack of resources. Some countries are struggling with a lack of resolve. Declaring a pandemic is charged with major political and economic ramifications. It can further rattle already fragile world markets and lead to more stringent travel and trade restrictions. They were reluctant to declare the global pandemic, which is generally defined as an illness that spreads far and wide throughout the world. They need to make it clear that the world was in the midst of a pandemic. So the professor and faculty director of the O'Neill Institute for National and Global Health Law at Georgetown University, it is clear the new coronavirus has been a pandemic and who is behind the curve. The number of cases and deaths change by the hour, topping 121,564 with at least 4,373 deaths across the world as of Wednesday morning, according to data compiled by Johns Hopkins University. I'm going to skip some of this, guys. The virus is slowing in China, where it originated in December. It's picking up pace across other parts of the world. Italy has the most cases outside of China, with roughly 10,149 infections, and followed by Iran with 9,000, and then South Korea. In the U.S., cases erupted over the last week to more than 1,050, spread across at least 36 states. I know my state, Iowa, just declared a state of emergency, you guys. California, some parts did yesterday. H1N1, the last time WHO declared a pandemic was during 2009 swine flu outbreak. And then the SARS one in 2002 and 2003. I'm going to skip some of this, guys. Health officials are taking this very seriously. We understand the implication of the word. The fact is, right now in countries, we have frontline health workers who need our help. We have hospitals who need our support. We have people who need our care, and we need to focus on getting our frontline health workers the equipment, supplies, and the training they need to do a good job. All countries need to reveal their strategies right now, he added. You know who you are. When asked which countries aren't doing enough to combat the virus, Ryan said he wouldn't call out individual countries, but said, you know who you are. I say call them out. Call them out. Some countries are still using a stringent testing criteria requiring people to show full symptoms, be over a certain age, or somehow linked to travel to China. Some countries haven't been able to stop the virus from spreading within their healthcare system or have given up tracing cases back to the original source. Some countries have not been communicating well with their populations and creating some confusion in the minds of the populations and risk communication. Trust between governments and their citizens really needs to come to the center. Wake up, get ready. Epidemics stress every component of a nation, he said. They stress governance, they stress trust between government and the citizen, they stress the hospital system, they stress public health systems, they stress the economic systems. In many cases, we're witnessing across societies a lack of resilience. It's a reality check for the government. Get up on the planet, wake up, get ready. The virus may be on its way and you need to be ready. You have a duty to your citizens. You have a duty to the world to be ready. There you go, guys. Like I said, my state called a state of emergency. The cities nearby are on lockdown, many of them, and I see it going through my city. And guys, take this seriously. Wash your hands. Do your part. All we can do is our part. Cough in your elbow. Cough in your sleeve. Show some, even if you're not sick, show some, or if you are sick and you're okay, show some humanity, for the people who are fragile, and cough in your sleeve. Wash your hands. I have something coming out in a little bit from a nurse that I think you guys will all find interesting. But right now, just keeping you informed. Have a great day. God bless you. And don't forget to say your prayers.